have vacuums, and let's say you've been in labor for a long time, you're pushing for a long time, and this kid's not coming out. We now have monitors that we put on women from the beginning till the end. And that monitor tells us if the baby's in trouble, if the baby's what we call under stress. If the baby's under stress, we normally, we monitor the baby very closely, because if the baby's under stress, we need to take the baby out before something bad happens to the heart. That means that the labor is too hard on the baby's heart. And maybe they have been in labor for too long. So a cesarean section is necessary. But before we do that, we want to make sure the baby's getting enough oxygen. If the labor has been very long, so we put this little thing right here in the skull. It looks like a little safety pin. So we poke the baby right in there, right at the skin, and we put this little monitor. Is an oxygen monitor.
Inside the mouth.
And yes, and usually we can see the head, but we cannot. It's not coming out.
Okay.
So we can go in and put the monitor in. It's just like hook it up a little bit, and babies can't feel at that point of the game. So you put it out, you hook it up like that, and that's a monitor, and that tells us if the brain's getting enough oxygen. If this part of the skin is getting oxygen, we know the brain's getting oxygen. If we see that is going down, we have to take the baby away right away. We're able to do a cesarean section in 5 minutes flat in an emergency. We literally go in, cut, open, take out. We don't worry about sizes. We don't worry about anything. We just go in and out. And then we worry about suturing and fixing whatever we cut in order to save the baby. And they're usually pretty good about doing that. They have a lot of practice in taking out a baby in an emergency like that. Yes.
Are there some women who, because of their pelvic area, the gynecologist can tell her from the beginning of the pregnancy that she's going to have a cesarean?
And not at the beginning. Usually we can tell more once you get to around 7 months, unless the woman was born with some abnormality in the bone structure in the pelvic area. But usually around the 7-8 month, we start seeing the size of the baby. Because babies don't gain a lot of weight till towards the end. They get bigger in size, but they're all bones and skin. They don't have fat. So they don't weigh much. They weigh around maybe 1 to 2 pounds. And then around when you're around 7 months pregnant, babies are usually around 4 to 5 pounds. And then the last 2 months is when they start gaining like a pound a week. I mean a pound a month kind of thing, or a pound, or half a pound a week. So that's when they do, and now they're getting all the fat from you, and the babies are becoming big. So around that stage is when we can tell if the baby's too large. An ultrasound can actually give us a weight. It's not 100%, but it can tell us if this kid is going to be an 8-pounder or 5-pounder or 7-pounder. With my daughter, who just had a baby 10 days ago, they said, oh, the baby's going to be around 7.5, maybe 8. Baby was 7.13. So they were pretty on the money. So it's, and they were a little bit concerned because if the kid came 2 weeks early, if they had stayed there long enough, that kid would have probably been around 9 pounds. So that was going to be a large baby. But so that's how they can tell, and it's more towards the end, like 7 to 8 months, that we can tell. But we still have plenty of time to plan something. And if we think that the baby's too big for them, then we plan it ahead of time. So we do the cesarean section in week 38 or week 37. Pregnancies, we count 40 weeks. So we plan from the first day of the period, 40 weeks. And then we plan it at week 37 and 38 before they possibly could go into labor. Because once you're around 37 weeks, you can go into labor really anytime. You're considered full term. So you could go into labor at 37 weeks, at 38 weeks, 39 for sure, 40 for sure. So anytime after 37. So we try to do it before the uterus starts contracting, because we don't want the uterus to contract and then for us to have to do a cesarean section. So we prefer, if we can avoid it, we avoid it. So we do it earlier. But unless there's some sort of abnormality in the bone already, like some people are born with fused pelvic bones. That I have seen a couple of cases only in my life in medicine, but that the pelvic bone was totally fused. The opening that it had, it wasn't. It was just like this. It was like a little tiny. It looked like a triangle instead, and she was born that way. But how they found that out is because the hip was displaced. Because as that was smaller, the hip was not in the right location. So that's how when they did the X-rays, they found out that she had that. But usually, we have this more like trial and error.
And another question, when you were talking about how women get pregnant, you said that one of the sperms sort of punctures the egg, and the rest move away.
Right.
So how do women get pregnant with twins or triplets? Or
They have 2 eggs.
so for each baby, there's an egg that.
Yes.
Okay.
Yeah, they were lucky enough. No. Depends what you think was lucky to get pregnant with 2. So you can have 2 eggs. You can have 1 egg that got divided and ended up with more sperm than it should. Sometimes that could be a trick also. But most of the time, normally it's 2 eggs. So we're supposed to have only 1 egg. They come out, usually the ovaries take turns, but sometimes, because they're both ovulating, but most of the time they speak to each other in a way, hormonally, and so one is the one who releases it first. But sometimes you can have the 2 of them releasing and the 2 of them getting pregnant. And those are the ones that have 2 different bags. The babies have 2 different water bags and 2 different placentas. So those are the ones who are not identical twins.
So where would a tubal pregnancy go?
A tubal pregnancy will get stuck in here, and then it starts growing. It grows at such a rate that it starts like the size of a pin, and then it grows to like the size of a dime, or a little less than a dime. And so the tube is not that big. The tube is really skinny, and the room inside is diminutive. It's not that much room. Like a catheter, for when we get
IV?
like IV. Okay, the size of that is usually the finer ones, right? That one inside, that's around the size that we have, room that we have inside. So we don't have much room in the tube. So once it starts, because the purpose is just to get it pregnant and then move on down. It stays there around 48 hours, it moves right down to the wall. But if it stays stuck, now it could stay stuck in here because of adhesions. That's scar tissue. Yes,
That's what you call the Jesus and gemelos?
and pregnancy, yeah, twins.
How you call that in Spanish?
Twins. Twins?
Identical twins?
Fraternal twins.
Well, there's a difference between fraternal and identical. You tell us.
No, go ahead, no, you can do it. You can do it. So there is.
All right, mellizos and gemelos in Spanish, right? That's what we're talking about when it comes to
Yes,
sequence.
twins, yes.
So, okay, mellizos is twins in English, right?
Yes.
People gemelos twins.
Gemelos too is the same word for
Is that
twins.
the same word?
It's the same thing, honey. It is.
I guess if she's identical and
I think that's what she's. Are you saying? Are you trying to? There is also twins that are identical and not identical.
Fraternal, right?
Fraternal, right?
Yeah, how do I say to a woman, you're gonna have gemelos? How do I say that in English?
Twins.
And then how do I gonna say to the same lady you're gonna have
twins.
Morochos, twins, gemacos.
What are you trying, I'm so sorry, we're not,
You don't want
I
to
think you wanna say what kind of
It's for
twins
you,
they're gonna have.
Yeah, exactly, that's what I mean.
Okay, so,
Identical.
so one is identical twins, which means the two of them come from the same bag.
That's what I mean.
And then, the other kind is, twins that are not identical, they come in two separate bags.
Alright, so those are the mellizo.
They were both the same word, you use the same word, the twins, twins, twins. You just have to say whether they're identical or not identical.
Alright.
And usually the doctor will let you know what they are, what you are. So ectopics are, when ectopic pregnancies get stuck here because of adhesions, because of scar tissue. It could be due to an inflammation, it could be due to an infection. Any of these things can cause you to have a scar tissue. So once the scar tissue is there, it doesn't go away. Actually, it gets worse with time. So if you have scar tissue, diseases like gonorrhea, chlamydia make a lot of scar tissue. Pelvic inflammatory disease, a pelvic inflammation disease, makes scar tissue. So all these scar tissues damage the tube, and then the pregnancy gets stuck, and then when it starts growing, it can rupture the tube. If it ruptures the tube, it's extremely dangerous. Usually the woman can lose their life if they don't come to the hospital in time, because you can start hemorrhaging. And because it's in the pelvic area, by the time you see some actual blood coming out of you, it may be full already inside, and you may be really in a lot of danger. So ectopic pregnancies, we now have different ways of dealing with ectopic pregnancies. We used to have to remove the whole tube right here and get the pregnancy out. We cannot save these pregnancies. And nowadays, we can, now because of better machinery and lasers, we can cut here and remove the pregnancy and sew back again, but still, that's gonna leave some scars eventually. We can also inject the pregnancy with this medicine that flattens out the pregnancy and makes it like get absorbed by the tissue. That's a newer way. Sometimes it works, sometimes it doesn't. And so the injection, we usually check with you every 24 hours. We need to do a blood test. Every 24 hours we do a blood test if it's an ectopic pregnancy, because every 24 hours the numbers, if we do the injection, the numbers should go down, that the pregnancy is going away. If the numbers are going up, and the numbers triple by day, they could be 1,000 today and tomorrow is 4,000. And the next day, it will be 9,000, because the pregnancy hormones are increasing and building up.
When you say 1,000, it's 1,000 counts of hormones.
Yes, with the hormones, with a particular hormone we're looking in there in the pregnancy.
Okay.
And so if that's the case, then we have to bring you into the OR and we need to remove it, because then the injection didn't work. We also could do the same if a woman got pregnant with, let's say, triplets. We call it a reduction. And let's say she doesn't want to have 3, cannot handle 3. We can inject one of the triplets and they dry up.
Oh my God.
And they look like this. When they come out, they look like this, like paper. This thin. They dry the triplet up, and they end up like this, flat, like the face, everything is flat like this. And it's a medicine that they use to flatten the twin or the triplet or more.
What is it technique again?
It's a reduction. A pregnancy reduction. Yes. Say it. I'm sorry.
I'm sorry to get eventually into this. I just
No.
because I saw something that I never saw. Because I know a friend that has endometriosis. So I didn't knew that the woman have a part called endometrium.
Right.
So when the woman has endometriosis, like what happens? Like what
Oh, sure.
causes that?
Good. Endometriosis is an actual disease that I'm going to show you a picture in the next pictures. They're going to show you a picture of that. No, that's fine. That's good. It's a good question. And endometriosis is a disease that what happens is that when we get a period,